Good afternoon. A few of you heard me present on the subject of addiction yesterday, in which I presented my comprehension, my understanding of this phenomena, and that understanding that I presented is based largely on the results of my work using this method that I call subliminal therapy in treating addiction. I have treated chemical addiction and non-chemical addiction. This phenomena of human capacity to be overwhelmed by some behavior, some interest, some investment. We use the term addiction. In general, we used to refer to addiction strictly in chemical terms, talking about street drug addiction, perhaps prescription addiction. It has been generalized, and I think legitimately, to embrace non-chemical issues. Addiction to gambling, addiction to sex, addiction to a variety of things, in which there is this preoccupation with and accompanying behavior that gets people in trouble. I have concluded, as I presented yesterday, that the underlying energy, the underlying force, the underlying influence that propels all addiction is psychological. You see, our bodies have the capacity to metabolize almost any chemical. How long does it take? Well, for tobacco, if a heavy smoker ceases abruptly on the order of a week, 7 or 8 days, the body has metabolized all of those chemicals that were carried into it through the tobacco smoke. Well, heroin will take a bit longer. And the body has the capacity to eliminate the chemical elements. Eliminate them completely. And yet the driving force can persist. It's as though this essential root of addiction it's a conditioned response from some assortment of experiences in life. Well, the person who is addicted has no conscious knowledge of the actual roots. Of course, in the case of chemical addiction, one of the driving forces is fear of experiencing that withdrawal. Well, that's powerful, and it is still psychological. Well, we can pretty effectively mask the symptoms of withdrawal. We can certainly at least ease them by medication, by the use of hypnotic technique. But that driving force may well persist. This method, subliminal therapy, is okay. If the problem is in reality a psychological issue, that is the consequence of conditioning, okay, it's working, then it makes very good sense to treat it psychologically. Of course, medical involvement is mandatory. Managing the withdrawal, if nothing else. But addressing the cause, identifying and resolving that underlying psychological force that is the consequence of life experience. That's the solution. I've had remarkable success in all areas of addiction. So I want to talk about the method itself. It's based on certain assumptions. The most basic assumption is that we are all conditioned creatures. The events that happen to us and with us have an effect, and sometimes that effect is lifelong in duration. Now, if other events occur that result in some reconditioning, then perhaps the influence from the initial experience is ended or modified by subsequent experiences. It may also, however, be compounded by subsequent experiences. And all of this happens without conscious awareness that that's what's happening. I illustrate that in this fundamental way. If a dog bites a child, it's very logical that that child would associate dogs and fear and be afraid of dogs, not just that dog, but all dogs. Well, as time passes, other experiences, other exposures, hopefully the child will learn that the problem is not with all dogs, it was only that dog. However, if such reconditioning does not take place, the child will continue to fear dogs. It's as though that lesson in that initial sensitizing event, the lesson that was inculcated, it's just there. It's like the file of a computer, in the memory of a computer. It doesn't change unless you pull it out and change it. Well, psychologically, pulling it out and changing it is a matter of affording other experiences that modify the earlier one. Well, if this person does not have conscious awareness of this underlying force, helpless. Nothing he can do. And that leads into this second assumption of this method, which is that we all have mental capacities that by far exceed our conscious mental capacities. We all have that. We couldn't stay alive. We can't consciously regulate all of the vital functions that's required to stay alive. And yet it happens in exceedingly intelligent, sophisticated ways. Overwhelming evidence that intelligence beyond conscious mentation exists. Well, if it exists, it makes sense to tap into that ability to make the changes that we need to make. That's what this method is about. These abilities absolutely can be engaged. In applying this method, the sequence of events in my practice is there will be an initial session, an initial visit by the patient, during which there's history taking, logistical issues, and so forth. And I, just as a matter of practice, offer to teach all of my patients self-hypnosis. I think it's a very valuable skill to have, not apt to be involved in the therapy directly, but indirectly it seems supportive. A very high percentage of my patients say yes, and we take a few moments during that first meeting for me to teach them that skill. Then I send them home with a little book, very small book, that I wrote for my patients to introduce them to this method. Saves a lot of tongue lashing on my part, time introducing the concepts and so forth. And then the next time we meet, very nice session, if they have read the little book, the stage is set. We just jump in and go to work, addressing whatever the problem is. We're talking about addiction here. But the protocol is the same regardless of the presenting problem. If the problem is psychogenic, and a very high percentage of both mental and physical problems seem to be psychogenic. Anyway, the stage is set. So there's a brief review, much like you're getting from me right now, overview of the method, and then I introduce the patient to their own higher level of ability, their own extra-conscious domain of their minds. I do that with a very simple little exercise. I propose to do that with you right now, if you're interested. We're not talking about weird stuff, actually, but you back off from it, and it is kind of weird. My first career in life was that of an engineer. Things I do routinely, witness routinely today, I would have considered to be unmitigated nonsense when I was an engineer. So I am testing the credibility. I don't know how many of you, but I know there are some out there who are hearing me right now who are wondering who this weirdo is up here. Well, I'm not a weirdo. I'm a very conservative old guy. And I have objective evidence, over 300 cases in which objective data was accumulated, and I am engaged in a controlled study on the treatment of chronic pain currently. The Mexican government is now undertaking a major study in using this method to treat addiction. Major study, just now getting underway down there. I'm really not all that weird. And I invite you to risk an experience I think you may find very informative. See, I am assuming that you, every one of you, has this extra conscious level of mental ability, kind of a higher intelligence. It would be my job, if you were my patient, to guide the course of therapy by guiding that level of intelligence to do the work of therapy. Well, just incidentally, just for convenience, I named that level of intelligence Zentrum, a German word meaning center, core. You have a centrum, and I am speaking to your centrum right now. And your centrum hears me, but I can't hear your centrum. So, if you were my patient, there would have to be some means of my getting information from centrum. Now, we can do this in different ways, but it turns out the most efficient, the most effective way is for you, my patient, to consciously create an image, maybe of a chalkboard in your mind's eye. Any platform, could be a computer screen, any platform on which Centrum can write, and then your job consciously would be to relay to me, verbatim, relay to me what Centrum writes on that chalkboard. I'm too enthusiastic up here. I get enthusiastic about this. Huh? 2 minutes, okay. I'll take advantage of those 2 minutes this way. I ask all of you, please create an image in your mind's eye, an image of a chalkboard. And I ask your Centrum to write a word on that chalkboard that you will not consciously expect. I ask Centrum maybe to select some off-the-wall word, truly a surprise word. I ask your Centrum to do that now. May I have a show of hands of those of you who have a word on your chalkboard? Okay. Now, question is, are you consciously satisfied that you did not consciously write that word? That's the first step in therapy. That sets the stage. That's an unusual thing to have happen. And now I can intelligently guide the protocol communicating with Centrum step by logical step. If I have engaged your interest, there's the place to follow up. If you want to talk some more afterwards, I'm here. Thank you for listening.